Welcome everyone, and thank you for joining our webinar today on diabetes. Did you know that approximately 26 million Americans have diabetes, but 7 million of them don't know it? As many as 1 in 3 American adults will have diabetes in 2050 if this present trend continues. Due to the widespread onset of this condition nation and worldwide, chances are you know someone with diabetes, have diabetes, or are at risk for the condition. For these reasons and more, everyone should understand what is diabetes, as well as preventive behaviors you can take to prevent, delay, or, if you're already diagnosed, manage diabetes. During this presentation, we will break down the definition, complications, and potential symptoms of diabetes, as well as the various types of diabetes and actions you can take to prevent, delay, or manage this condition. Diabetes describes a condition in which the body cannot make proper use of carbohydrate in food because the pancreas does not make enough insulin, or the insulin produced is ineffective, or a combination of both. Insulin is the hormone that helps glucose, or sugar, from the digestion of carbohydrate in food, move into the body cells where it is then used for energy. When insulin is not present or is ineffective, glucose builds up in the blood. This is because insulin is the key which unlocks the door to the body's cells. Once the door is unlocked, glucose can enter, where it is used as fuel for energy so we can work, play, and generally live our lives. If there is little to no insulin present in the body, as in type 1 diabetes, then there is no key to unlock the door and the glucose stays in the blood. When there is not enough insulin, the cell doors are only partially unlocked. Or when there is a lot of insulin but the lock doesn't work properly, sometimes referred to as insulin resistance, this is type 2 diabetes. There are several ways to diagnose diabetes. Each way usually needs to be repeated on a second day to diagnose diabetes. Testing should be carried out in a healthcare setting, such as your doctor's office or a lab. If your doctor determines that your blood glucose level is very high, or if you have classic symptoms of high blood glucose in addition to one positive test, your doctor may not require a second test to diagnose diabetes. Your doctor will determine which test is best for you. To review, there are a variety of diabetes classifications. Type 1, which was previously known as juvenile diabetes. In this classification, the body does not make enough insulin. Insulin helps the body use glucose from food for energy. People with type 1 diabetes need to take insulin every day. Type 2 diabetes, or previously referred to as adult onset diabetes. In this classification, the body does not make or use insulin appropriately. People with type 2 diabetes often need to take pills or insulin. Type 2 diabetes is the most common form of diabetes. Of those who have been diagnosed with diabetes, only 5% are type 1. The vast majority, at 95% of those with diabetes, have type 2. Prediabetes is before people develop type 2 diabetes. They commonly then will have prediabetes, which include blood glucose levels that are higher than normal, but not yet high enough to be diagnosed as diabetes. In fact, 79 million Americans have prediabetes. Finally, there is gestational diabetes. This may occur when a woman is pregnant. This can raise her risk of getting another type of diabetes, mostly type 2, for the rest of her life. It also raises the risk of the child of being overweight and developing diabetes as well. Diabetes can increase the risk for many serious health problems. Here are a few complications of diabetes. Blindness. Diabetes is actually the leading cause of new cases of blindness among adults aged 20 to 74 years. Dental health. Almost 1/3 of people with diabetes have severe periodontal disease. Heart disease and stroke. Adults with diabetes have heart disease death rates about 2 to 4 times higher than adults without diabetes. The risk of stroke is 2 to 4 times higher among people with diabetes as well. Kidney failure. Diabetes is the leading cause of kidney failure. nervous system damage. About 60% to 70% of people with diabetes have mild to severe forms of nervous system damage. This can lead to amputations, loss of feeling in the foot, and gastroparesis. Amputations. More than 60% of non-traumatic lower limb amputations occur in people with diabetes. While these are examples of very serious complications, there is good news. With the correct treatment and recommended lifestyle changes, many people with diabetes are able to prevent or delay the onset of complications. Be sure to discuss your condition and personal risks with your healthcare provider. Now let's all take a brief moment to assess our personal risk level for diabetes by completing the diabetes risk test as you see here on the screen. I'll leave this up for a few moments and let you circle your answers at your desk and then tally your points. Now that you have your points tally, if you scored a 9 or higher, you are at high risk for prediabetes. Please consider having your blood glucose tested for elevated levels immediately. If you scored 3 to 8 points, you are at a lowered risk for prediabetes. However, it is still recommended that you maintain or adopt healthy lifestyle behaviors to remain at a lowered risk level. For future reference, or if you are not able to finish this quiz today, a copy of this risk test can be found at ohio.gov/TCLW. Diabetes often goes undiagnosed, as many of its symptoms may seem harmless. Recent studies indicate that the early detection of diabetes symptoms and proper treatment can decrease the chance of developing the complications of diabetes. If you have one or more of these diabetes symptoms as shown on the screen, please see your doctor right away. Remember that diabetes may not present with any symptoms. It is imperative that you maintain healthy lifestyle behaviors, have your glucose tested regularly, and discuss your risk for diabetes with your primary care physician. Here, we see some healthy behaviors that you can engage in to lower your risk for diabetes. Based on your current habits, start with a few changes that are easy to tackle. Pick some changes that you want to do the most and that will make the biggest impact. Perhaps choose one change in your eating habits and another in activity. Remember, don't try to change everything at once. Start the lifestyle change cycle again. Choose some new goals to work on. Slowly, goal by goal, over time, you'll be eating healthier and being more active, and you'll be at a healthier weight. For those who have already been diagnosed with diabetes, it is also important that you maintain healthy lifestyle behaviors and ensure that you have proper treatment for your condition. You should be receiving your diabetes care from a team put together by your doctor. Diabetes is complicated. Your doctor alone cannot be an expert in every area. For this reason, your diabetes care team may include an eye doctor, nurses, and a dietitian. Depending on what complications you may have, your doctor may refer you to other specialists as well, such as a foot doctor or a podiatrist. Keep in mind that you are the most important member of your healthcare team, as it is ultimately up to you. After all, you are the one who is affected by diabetes and cares for it every day. Only you know how you feel and what you're willing and able to do. You are the most important member of your healthcare team. You do the exercise. You are responsible for adhering to your appointments and the treatment plan set for you by your medical care team. You prepare and eat the foods on your meal plan. You take the medicine or inject the insulin. You check your blood sugar or glucose levels and keep track of the results. And of course, you are the first to notice any problems. Your healthcare team depends on you to talk with them honestly and to tell them how you're feeling. Here, we have some common myths versus facts of diabetes from the American Diabetes Association. Myth number 1, people with diabetes can't eat sweets or chocolate. When in fact, if eaten as part of a healthy meal plan or combined with exercise, Sweets and desserts can be eaten by people with diabetes. They are no more off limits to people with diabetes than they are to people without diabetes. The key to sweets is to have a very small portion and save them for special occasions, so you focus on your meal on more healthy foods. As always, please work with a registered dietitian or your healthcare provider to verify what meal plans and what specific foods are right for you and your condition. Myth number 2, eating too much sugar causes diabetes, when in fact, diabetes is caused by a combination of genetic and lifestyle factors. However, being overweight does increase your risk for developing type 2 diabetes. Eating a healthy meal plan and the regular exercise are recommended to manage your weight. Myth number 3, people with diabetes should eat only special diabetic foods, when in fact, a healthy meal plan for people with diabetes is the same as that for everyone. Low in fat, especially saturated and trans fats, moderate in salt and sugar, with meals based on whole grain foods, vegetables, and fruit. Diabetic and dietetic versions of sugar-containing foods offer no special benefit. They still raise blood glucose levels, are usually more expensive, and can also have a laxative effect if they contain sugar alcohols. Again, please make sure that you are working with a dietitian and your primary care physician when determining what foods are right for you. Myth number 4, if you have diabetes, you should only eat small amounts of starchy foods such as bread, potatoes, and pasta. In fact, starchy foods can be part of a healthy meal plan, but portion size is key. Whole grain breads, cereals, pasta, rice, and starchy vegetables like potatoes, yams, peas, and corn can be included in your meals and snacks. You may need more or less carbohydrate at meals depending on how you manage your diabetes. You and your healthcare team can figure out the right amount for you. Once you know how much carbs to eat at a meal, choose your food and the portion size to match. As a reminder, everyone's dietary needs are different. And myth number 5, fruit is a healthy food. Therefore, it is okay to eat as much of it as you wish. In fact, fruit is a healthy food that contains carbohydrates, fiber, and lots of vitamins and minerals. It needs to be included in your meal plan. However, talk to your dietitian about the amount, frequency, and types of fruits you should eat to best manage your condition. If you have diabetes and are cleared for physical activity, your healthcare team will likely advise you to engage in some form of exercise for condition maintenance. Your healthcare provider's advice will depend on the condition of your heart, blood vessels, eyes, kidneys, feet, and nervous system. Be sure you do the following. Get advice on what to consider and how to talk to your healthcare team about getting active. Talk to your healthcare team about which activities will be safe for you. Tell your provider if you have pain in your chest. Talk with your provider about joint or bone problems that may make it difficult for you to exercise. Ask your provider about how increasing your activity level might impact any medicines you take for diabetes, blood pressure, and or heart problems. You may find it motivating to write down what physical activity you've done each day. Choose what you'll do and make detailed plans. Think about what activities are realistic for you and choose the ones you think you can do. Start slowly. Your activity should be somewhat challenging, but not overly difficult. Plan to have water and snacks handy during activity. Drink plenty of water before, during, and after activity. If you are at risk for low blood glucose, always carry a source of carbohydrate too, so you'll be ready to treat low blood glucose if needed. And finally, wear a medical identification bracelet, necklace, or a medical ID tag to protect yourself in case of emergency. Now that you have the facts on diabetes, here we have provided some information for you on what the State of Ohio's Take Charge, Live Well program has for support. A vital piece to Take Charge, Live Well is the Diabetes Prevention Program. Without intervention, people with prediabetes have an increased risk of developing type 2 diabetes, heart disease, and stroke in 10 years or less. This is a two-part process. designed to identify individuals who are at risk for diabetes. The first part of this process is obtaining a hemoglobin A1C test. If this test shows that you are at high risk, you are eligible to participate in a 16-week coaching program in a classroom setting or at a local YMCA location or at your work site. During these sessions, a trained lifestyle coach will help you change your lifestyle to make a large impact in preventing diabetes. Learning objectives include nutrition, physical activity, overcoming stress, and staying motivated to make a healthy lifestyle change. It is important to note that the Diabetes Prevention Program is only available to those enrolled in the State of Ohio United Healthcare Plan and is free of cost to eligible employees. To participate in the Diabetes Prevention Program, employees, spouses, and dependents aged 18 or over must meet one of the following criteria. Score 6 or higher on the Diabetes Risk Quiz, as we saw earlier. This quiz is also available online or at on-site biometric screening events. Next, has been diagnosed with prediabetes from their nurse or doctor and have a body mass index, or BMI, of greater than 25. Has had a testing result of fasting plasma glucose of 100 to 125 with a BMI of greater than 25, or has had a testing result of hemoglobin A1C of 5.7 to 6.4 with a BMI of greater than 25. Additionally, participants must carry United Healthcare. Please check ohio.gov/TCLW for a diabetes risk quiz, list of upcoming biometric screening events for A1C testing, and more details about the Diabetes Prevention Program. To sign up for the Diabetes Prevention Program, please call United Healthcare at the number you see here, or enroll at an on-site screening event after receiving your A1C test results with a representative from the YMCA. As of September 2013, the State of Ohio's Diabetes Prevention Program now offers online options as well. With this program, you can get the encouragement and support you need from a virtual coach, easily track your weight loss, utilize the wireless scale feature, and have access to social networking with people who share similar goals as you. The same qualification requirements still apply. In order to qualify to participate, employee, spouse, or dependent age 18 or over must meet one of the following criteria. Has been diagnosed with prediabetes from their nurse or doctor and have a BMI of greater than 25. Has had testing result of fasting plasma glucose of 100 to 125 with a BMI of greater than 25. Has had testing result of hemoglobin A1C of 5.7 to 6.4 with BMI of greater than 25. For more information or to register for this program, please visit the Diabetes Prevention Program page at ohio.gov/TCLW. For members who currently have diabetes, the Take Charge Live Well program offers a diabetes management program. Through this program, members are eligible for free diabetic supplies and medications. The required guideline for this service is having had a hemoglobin A1C test within the last 12 months. For those that meet the guidelines, certain supplies, durable medical equipment, and medication are provided at no copay and no deductible. Certain values for each test are not required, only that the member has had the test. However, if this criteria is not met, members will have coverage for these items with copays and deductibles under the normal provisions of the State of Ohio benefits. For a list of available supplies, durable medical equipment, and medications, please visit ohio.gov/TCLW. Thank you for attending this presentation. We hope the information provided has been helpful in providing you more insight into diabetes. Additional information and resources can be found on the Take Charge Live Well website at ohio.gov/TCLW. There are pages specifically designated for the Diabetes Management Program, the Diabetes Prevention Program, and other information on diabetes. Here, we have also listed the phone number for HEALTHWAYS health coaching, as well as customer service and information on the Diabetes Management Program.